hospital discharge, patient throughput is a major issue in the country. When the doctor makes a decision that we're discharging this patient, around 9, 10 o'clock, and this patient is going not home, but going to a skilled nursing facility or transitional care unit or rehab center, wherever they're going. Once the decision is made, now they're trying to figure out how am I going to get that patient to wherever they're going. That delays the discharge. That makes the patient unhappy because in their mind, I'm leaving in 1 hour and now it's 2 hours. Their staff is wasting their time chasing after transportation, which is the bottleneck, the friction point. We're reacting, again, leveraging technology to make sure that we're delivering service better than anybody else.
KC Kanaan, CEO of Envoy America, joins us today. Envoy focuses on providing transportation services for elderly folks. Thanks so much for the time and welcome.
Thank you. Thank you for having me on the show.
Of course. So let's take it back to the start. I'd love to hear about how you started the business. I know that you saw your parents struggle with some of the same issues when it came to getting transportation for medical care. So tell us about that and what inspired you to start the business.
Absolutely. So my parents started getting older and dealing with medical conditions. My siblings and I did not live in the same area where our parents lived. And over a number of years, we saw the impact of not having the right transportation solutions that are designed for older people or older adults or people that have medical conditions. We saw the impact on their health, their outlook on life, they became isolated, disengaged, not wanting to leave the house, and it's all due to the transportation services. They tend to be unreliable, not designed for older people, and older people don't like what the options that they have. So after seeing the impact for a few years, we had this aha moment that this problem is bigger than the Kanaan family, and we decided to do something about it. And that's when we launched the company 10 years ago.
Wow. And I want to jump into what that growth looked like. But before we get into that, you've worked in quite a few different industries and sectors, and you can touch on some of them. What makes working in healthcare uniquely fulfilling to you?
That's a great question. The biggest difference is you're dealing with humans. You're dealing with either older adults, patients, or people with disabilities. If they were healthy or were able to drive, they will not need our service. So what makes it different is that the clients that we serve, they do need the service. They do need somebody to help them if they need the help. If all they need was to go from point A to point B, they can use Uber or taxi or drive themselves. So what makes this different is we're dealing with humans that are at a point in their life where because of illness or old age or cognitive challenges, they need help, and we're there to give them the help and treat them with dignity to allow them to do the things that they need to do to stay healthy, socially active, independent, and live a normal life.
Absolutely. Maybe talk us about, for someone that uses your product, what is that experience like, right? I think one thing that you spoke about is using state-of-the-art wheelchairs, for example, right? Which is something you don't have to do, but you do to make it just an incredible experience for your end user.
So let me give you an example. If we're taking somebody to a medical appointment, normally the client would know that they have an appointment tomorrow or next week. So they make reservations in advance. If we've served them before and they're comfortable with the driver companion, and we refer to our drivers as driver companions because they do more than just they drive. They can make reservations and ask for a specific driver. The driver would call them the night before, around 5, 6 o'clock, to confirm that they're still going, confirm the address. If you think about it, this puts that patient or older adult at ease that somebody's coming to pick them up. The day of the appointment, if the pickup is at 10 o'clock, the companion driver would walk to the door a few minutes before 10 o'clock. This is not they wait for them at the curb and get in the car. No, they walk to the door, they knock at the door, and they're trained to take a few steps back. Why is that? Because if somebody's looking through a peephole and they see this complete stranger, it's not going to put them at ease. So they're keeping the patient in mind, or the older adult. As they're walking to the vehicle, they offer to help. If they're carrying a bag, if they're carrying something, they offer to help, not say, let me take over, because again, we're still dealing with humans that have their pride. When we get to the car, we open the door for them. We help them into the car if they need help with the seatbelt, and there's a way to help them with the seatbelt without touching them. The last thing an older person or a patient wants is somebody, a stranger, touching them. So we do this. If they're using a walker or mobility device, we're the ones who are stowing it in the car. Mm-hmm. We're carrying a conversation along the way, asking about their day. If they're retired, what did you do before retiring? How long have you lived here? Just to make the experience all about them. Knowing that older adults, they're lonely. They need somebody to talk to. So just try to bring a smile to their faces. When we get to the destination, depending on the type of appointment, if this is a quick pharmacy visit, lab visit, 1 hour doctor appointment, we stay with them. So this way they don't have to wait on the return trip, or they can make another stop, go to the pharmacy, go to a lab. And once we get home, we walk them to the door, make sure that they're safe, and then leave. So it's more than just a ride. It's a service. We don't provide rides. We provide a service.
That's really interesting. I'd love to understand how that ties to the outcomes of these patients as it relates to the series of issues or concerns that they may have. And maybe talk to us about some stories of some of the most incredible things that you've done for patients and how it's changed their outcomes.
So, as far as outcomes, the data shows that roughly 3.6 million patients miss their doctor appointments a year, and it's due to transportation. So we play a role in making sure that the patients get to their appointments on time. We also know that some patients need more if they're doing radiation therapy, or if they're going through kidney dialysis. Kidney dialysis, they're normally sitting in a room, cold room in the 50, 60 degree for about 4.5, 5 hours. We make sure that when we're bringing them to the car, we're walking with them, we're lending a shoulder, we're keeping an eye on them. So if they're tired, we're there to help them. We keep the temperature in the car as high as possible until they feel comfortable that, yes, I'm good to go. Even in places like Arizona, where we're headquartered, in the summer, we turn the heat all the way up to make sure that the patient is comfortable. When we bring a patient home from a medical or from a hospital, and they've been in the hospital for a few days, they're getting discharged. Not only we walk them to the door and make sure that they're safe inside the home, which will play a role in minimizing the readmission rate back into the hospital. We're the ones who would take them to see their doctor the next day or the day after for the follow-up meeting. We're the ones who are reporting back to the social workers and the case managers about their conditions if we notice that inside the house there are boxes everywhere, the garbage hasn't been taken out, that the the food doesn't look good in the fridge. So it's not one thing that we do for better outcomes. It's all the small things that add up to, from, again, the same driver serving the same client again and again. They get to know them. They become like a surrogate son or daughter to them. If they notice changes in their either cognitive or mobility situation, they're trained to report back to whoever, either their family members or the social workers, or if this is a health plan, whoever is the case manager in this case, to make sure that we're taking care of the patients, the members, the older adults that we're serving.
And you've spoken about how this is the solution to the son or daughter dilemma. Talk to me about how this resonates across, whether it's health plans or families, or would be really curious to hear.
Sure. So again, if we go back to why did we start this company? My siblings and I did not live next to our own parents. And this is not unique. The way things are now in our country, people move. It's not the way it used to be, where you live next to your parents and grandparents and take care of them. So our companion drivers become the surrogate son or daughter. We're the ones who are interacting with the daughter or son that lives in Chicago or New York, and their mom lives in Phoenix or in Florida or Texas. We become an extension of their family. That helps the family keep their parents in a good place. But from a health plan, again, we're helping the health plan deliver care to that member, to make sure that they're happy. When we show up on time, they're happy with the health plan, United Healthcare or Cigna or Centene, or you name it. They're not saying Envoy America didn't show up. They're saying my health plan didn't take me to my medical appointment. So there's a direct impact on the health plan. If we do a good job, they're going to be satisfied with the service, with the health plan, so their star rating is going to either maintained or it goes up, so they can benefit from that. If we do a good job, and we do, we can help them recruit or maintain their existing members, keep them, or get new members. So we, as far as the health plan, we bring benefits to them by helping them keep the members that they have, and sometimes increase it, maintain their star rating, if not increase it, and control their costs, because we know how to deliver service at competitive rates.
And what I thought was really interesting is you mentioned you actually do no marketing. All your growth has been mostly word of mouth, right? Why did you decide to take that approach? And maybe talk to us about the Jumbotron story that we were talking about earlier.
So for us, it all happened on its own. If we know how to do one thing and do it right, it's delivering service. So when we first started, our go-to-market strategy was business to consumer. We wanted to help people like our own parents that lived at their home, and that's where most older adults want to live. We were lucky that two newspapers did stories on us, calling us Uber for seniors. This Arizona Republic and the Jewish News. And to our surprise, we started getting calls from businesses that were asking us, "Can you help us? Can you help us?" So one of the first clients was the American Cancer Society. They have a program. It's called Road to Recovery. Any cancer patient can call them, and they would take them to and from medical appointments. Normally, they would rely on volunteers, but volunteers are not available all the time to take patients, especially if it's 6 a.m. So they wanted to try the service, the American Cancer Society. We started a pilot. It was supposed to be 90 days, and within less than a month, they said we're ready to convert from a pilot into an agreement. We did a good job for them in Phoenix. That's where it started. And then a few months later, they said, you guys did a great job here. Can you go to Tucson? So we went to Tucson. Then they said, you did a good job in Phoenix and Tucson. Can you go to Seattle? So we went to Seattle, and then we started expanding. So it wasn't by design where it's word of mouth. It was, we just did a good job for corporate clients. We were lucky that these corporate clients had operations across the country, and we expanded. And so all the growth has been similar to this with companies like the Jewish Federation or organizations. It's not a company. It started in Phoenix, and then from Phoenix it went to New Jersey, and then from New Jersey it went back to Tucson, and then now we serve them across the country. And it's not just medical or religious services. It's anywhere they want to go, from just driving around if that's what would make the older adult happy, or go to a baseball game. So to elaborate more on the Jumbotron story that we were discussing, one of our market segments that we serve is senior living communities. If you're familiar with senior living communities, they all have a bus or a van that spend at least $100,000 to buy this vehicle that sits there 95% of the time. They get to use it 2-3 times a week on a good week. So what we do when we work with senior living communities is they subscribe to our service. We help them reduce their CapEx. They don't need to spend $100,000 on a vehicle. We help them reduce their operating expenditures. They don't need to hire drivers or pay insurance, gas, maintenance, you name it. These vehicles get 8-9 miles to the gallon. The service that their members get, or the residents that live at the community, is better than anything else. And we take them to places from sports activities to go watch the Twins in Minnesota, or go to professional football games, the Eagles in Philadelphia, or Arizona State University play, to go to the state fair, the casino, lunch outings, go shopping, whatever they want to. As far as when we take somebody to a baseball game, professional baseball game, or any activity where we can do more to bring a smile to their face, we would talk to the stadium and say, hey, we're bringing 20 older adults. Can you do something nice for them? And normally 99% of the time they would say yes. And the thing that we've been doing again and again is getting them on the Jumbotron, and just the surprise on their faces, like as if they won $1 million. They're happy, they're smiling. It's like, can you take my picture with this? And they're sharing it with everybody. It's just the joy of seeing the smile on their faces, because they got to do things and experience things that we normally don't experience.
Such an incredible story. And I think a lot of what you're saying resonates to a lot of the folks that I think about in my life, and how much they would enjoy services like this. So hats off to you and your team for building that. The thing I want to talk about next is scaling, because, you started in one city and you can quality control one city or 2 cities. Now you're in 300 plus cities, right? So talk to us about the scale up, and then talk to us about how you make sure that you keep your quality of service high as you've now gotten this large.
Sure. So it starts and ends with who we recruit to come and work for us. We're very disciplined with who we recruit, how we recruit, what we look for, the questions that we ask, to make sure that the person who's doing this is doing it for the right reasons. We're serving older adults and patients and people with disabilities. This is not take somebody to work or somebody to the airport or home from being out enjoying themselves for the evening. So it starts with the right people on the bus in the right seats. And that's where it starts. But technology plays a key role in everything that we do, from recruiting. It's all technology based, leveraging Meta and Google ads to recruit the right people and running them through the process. Training, how we train the companion drivers, from how to interact with older adults that might be experiencing memory losses, dementia. We're one of very few companies that do this, and as far as I know, we're the only company who has ever been awarded the Dementia Smart Award, because everybody's trained to serve people with cognitive challenges. The monitoring what we do, monitoring to make sure that that companion drivers are driving safely. Similar to if you use Allstate or State Farm or Geico these days, they install something in your car and they can track how fast you're going, hard turns, speeding, hard braking, acceleration. We track it and we get notified if and when somebody's not doing what they're supposed to be doing, and they get coached up or coached out. And the ones who do a great job, they get praised and recognized and celebrated. But it's all technology driven. We leverage technology to make sure that we deliver the service the right way. So the industry that we're in, the way it works in general is, if it's a hospital or a medical entity, we're working with them. They say Mrs. Smith needs to go from her home to our office. Her appointment is at 10 o'clock, and when she's done, she'll call you. So we get the address for her home, the address where she's going, what time we need to be there, and then we'll call you when we're done. We take all of this and we leverage the technology that we've developed to figure out what time do we need to pick up Mrs. Smith to make sure that she gets to her destination on time. We look at, again, leveraging technology, AI, to see have we served Mrs. Smith before. If we have, how long did it take? How long does the appointment take? Looking at technology to say, okay, is this a kidney dialysis appointment, 4.5, 5 hours, or is this a quick 15-minute appointment, and make a decision. Do we keep the driver or do we send the driver back at a specific time? So the satisfaction level gets higher and higher. People hate to wait, especially after a medical appointment. Nobody wants to wait. I don't want to wait. I want it done yesterday, not in 5 minutes, right? So we've developed our own technology to be able to deliver service better, to be able to monitor what we're doing, to be able to react to issues. So we're tracking all the movements. If let's say a driver, companion driver is on a service now, and then they have another one in 20, 30 minutes, we're tracking them. If they're late, we react. We're not waiting to get a call from Mrs. Smith saying, where's my car? We're reacting, again, leveraging technology to make sure that we're delivering service better than anybody else.
And what are some of the pieces of technology that you're the most excited about as we think about the next 5 to 10 years, or ones that you're testing right now and you're going to be deploying out over the next little bit?
We continue to refine our technology. The ones that we're investing in now is to integrate with healthcare systems. So the Epic system or something similar is integrating. So let me explain it using an example. Hospital discharge, patient throughput is a major issue in the country. When the doctor makes a decision that we're discharging this patient, around 9, 10 o'clock, and this patient is going not home, but going to a skilled nursing facility or or transitional care unit or rehab center, wherever they're going to continue the care. The discharge nurse, somebody, a caseworker now is calling the other places, communicating with them either email or electronically to say, can you take this patient? Once the decision is made, now they're trying to figure out, how am I going to get that patient to wherever they're going? And in general, no, this is not on demand if you're using a specialty vehicle, a vehicle that needs to accommodate somebody in a wheelchair or a stretcher. So that delays the discharge. That makes the patient unhappy because now they're planning on going, and in their mind, I'm leaving in 1 hour, and now it's 2 hours, 3 hours, because they're waiting on transportation. The hospital can't discharge them, which means they're not making money because they're not admitting a new patient. The skilled nursing facility is not admitting a new patient, so they're losing money. Their staff is wasting their time chasing after transportation, which is the bottleneck, the friction point. We have a solution and we've been deploying the solution for years, where it removes the entire friction. They spend a few $100s a day with us. They subscribe to the service. We allocate and delegate vehicles to their hospital so they can react in minutes, not hours. It's all done through technology, so it's part of their system. They discharge the patient. The information is in our system. The driver reacts. And in general, when a patient is getting discharged and going to a skilled nursing facility, that's a 2-3 mile trip. So we can do 1 to 3 trips an hour, and we charge an hourly rate. So you have predictability as a healthcare system, what your cost is. You don't need to wait on the insurance company to say, yes, I approve or not. They spend $50 to $100 to empty a bed and admit a new patient that they're going to make tens of thousands of dollars for that new patient. It's a win-win-win-win for the patient because they're going to where they need to go, win for the hospital because they can discharge, optimize how they do things and make money, win for the skilled nursing facility, and obviously a win for us.
Yeah, and it makes the care journey just so seamless for the patient, which I think is the most important. So
absolutely. Again, going back to the wheelchair that we use, it's a chair that can work as a wheelchair or a stretcher. If the patient needs to be declined, it can decline, recline, lay flat, sit normally, and it can be managed by one person. So some of the bottlenecks when somebody is in a stretcher is you need 2 people to do this. So the cost gets higher and higher. It's if you have a bariatric patient, you need 2 people. We put technology in our vehicles. I don't know if it's even technology. It's a winch. So you attach just like when you're pulling a boat into the trailer out of the water, you attach the hook to the boat and you pull it. We do the same. So we're not taking much risk with a driver hurting their back and the patient is being safe. Put it in the car and unload it when it's time to unload them. It's all these small things coupled with dash cams in the vehicles, telematics in the vehicles, that you know exactly where you are at every point of the journey. So that gives the comfort, the peace of mind for everybody. But
right.
At the end of the day, we're delivering better service to the patients. We're addressing the patient throughput problem. We're helping the hospitals make money and save money. I mean, it doesn't get any better than this.
Absolutely. So taking just a step back, what are some of your biggest or boldest predictions you have about aging in place and senior care over the next 10 years that you hope come true?
I don't know if I have bold predictions. What I know from my experience from working with my own parents and also the thousands and thousands of older adults that I've interacted with in the last few years, people want to age in place. People want to stay at home because this is where they're comfortable. This is where they're used to, where everything is. It's just, moving when you're 89 years old is not a good experience. And normally when they move, no matter how nice the senior living community is, you're talking about a small space compared to somebody's home. So my prediction is people want to continue to age in place. You need technology to help with remote monitoring, which exists today, but I'm sure it's going to continue to evolve and get better. Telemedicine is going to continue to evolve and be used to deliver care to the patients. That's what I see, just the continuation of where we are today and make it better with newer and more innovative solutions.
Got it. And how do you see Envoy fitting in? One of the big trends we talk about is the move to value-based care. I'm sure a lot of the health systems are thinking about value-based care. And through this conversation, it's become pretty clear that this is such a positive addition to any care outcome that a patient's going to have. How do you think about fitting into the value-based care landscape?
Again, that's a great question. We've been doing it for a few years. Working with health plans, working with providers that do the value-based. What I call it is putting our money where our mouth is. If we think we're that good and we are reliable, well, we're willing to do the capitated model. So we love value-based because we all share the rewards if we do a good job and help keep the patient healthier and save money. And we do this by bringing them to their appointments on time, by taking them home on time and making stops as needed, by keeping them happy because they don't have to worry about things that are irritating. But we're excited about value-based care, and we're doing it and have been doing it.
Got it. And one of the final questions I have is, what is your vision for expansion, right? So is it more services, more different types of technology, geographies? Where do you see the business going over the next couple of years?
It's all of the above, everything that you've mentioned. We're going to continue to invest in technology to make sure that we're helping our clients have a better experience as we are serving them, and obviously help us differentiate ourselves and do it in a more efficient manner. When we expand, it's based on a corporate client saying we would like to evaluate your service and work with you. We don't just expand and hope and pray that somebody's going to use us. We expand when we have a partner that is open and willing to work with us. Providing more services, different services, we'll see how that goes. But what I tell our team is we haven't even scratched the surface. It's even though we operate across the country, we're still a small player that is growing, and the opportunity to do more to help more clients is there, and that's what we're going to continue to do.
Awesome. Any final words? Anything else we didn't touch on today?
No, you did a great job, Bob. Just want to leave with one final story. And this happened, the lady, her name is Mrs. Lipsman. I met her when we first started, so 10 years ago. And I still drive every now and then, at least every other week I drive just to stay connected to our clients and see what our drivers do day in and day out. But I got to know Mrs. Lipsman very well. She's from Chicago and has been living in Phoenix for, call it 40 years or so. And most clients, they have my cell phone. So I get a call from her on a Sunday morning around 6:30. It was like, okay, I hope she's okay. And it was like, did I wake you up? And like, no, it's okay. It's everything. I mean, I'm worried. I'm worried about Mrs. Lipsman. It's like, no, but I wanted to get your advice. I was like, okay. She said, you know, I'm from Chicago. I was like, yes, I do. And you know that the Chicago Bears are playing the Arizona Cardinals today in Arizona, and I'm going to see the game with my friends. I don't know what to wear. Should I wear the Bears colors, white, or should I wear red for the Cardinals? And I love both teams. And what do you do? I bring this story because the clients that we serve, some of them have lost a spouse, and if they haven't lost a spouse, the spouse might be ill or dealing with challenges. And if we listen to them, and our companion drivers do, and our staff, the client care team and dispatch team, they do, we become a family member to them. They get to invite us to go spend Christmas and Thanksgiving with them, and we do the same. And this is what this business is all about. It doesn't matter if you're in one city or 500 cities. It's still, at the end of the day, we're dealing with people, and we need to treat them the way we expect somebody to treat our own parents. And if we continue to do this, I think that there's no limit for us on how we continue to grow, but it's all about taking care of people.
Awesome. Well, thank you so much for joining us, and appreciate it.
Thank you.
Thanks.
Appreciate it.